Your relative may have just been given their first prescription for a psychotropic medication. Psychotropic is a general term for medications used to treat mental health conditions, or they may be going through what feels like their 100th prescription change. Maybe they're so discouraged with side effects or lack of improvement that they've decided to stop taking medication as part of their treatment. It's not uncommon for someone with a mental health condition to be prescribed a variety of medications throughout their lifetime. Not all medicine works for everyone, so there's often some trial and error before finding the right solution. It frequently takes a combination of medicines to treat the symptoms and side effects. Fortunately, there are a variety of effective medications available. Many people lead productive lives, in part due to the effectiveness of medication. Roberto is talking to his pharmacist. She is going to help him and us understand how some commonly prescribed psychotropic medications work. This takes time since there are a variety of options available. She begins by talking about medications that are often prescribed for depression. Typically, the first class of medications used to treat depression are selective serotonin reuptake inhibitors, or SSRIs, and selective norepinephrine reuptake inhibitors, or SNRIs. Messages travel through the brain once the neurotransmitter has docked on the receiving cell. Once the message has passed through, the neurotransmitters are either reabsorbed by the sending cell, called reuptake, or dissolved in the synapse, called metabolization. SSRIs and SNRIs block the reuptake of particular neurotransmitters. Depending on the medication taken, different neurotransmitters are stopped from traveling back into the axon terminal. This increases the levels of neurotransmitters in the synapses so messages can pass through. SSRIs and SNRIs have been found to be very effective in treating depression and have lower risk of being fatal if taken in overdose. Roberto mentions that he has heard there are a lot of complaints about dry mouth, weight gain, and sexual problems from people taking SSRIs and SNRIs. The pharmacist explains that a provider will start by prescribing a low dose and slowly increase dosages to a level that is effective. Following these instructions will reduce side effects. Side effects for SSRIs and SNRIs are less common than many other medications, but can still be bothersome for some. Since these neurotransmitters are found throughout the body and not just in the brain, the medication can affect other parts of the body. Side effects can include nausea, nervousness or agitation, dizziness, reduced sexual desire or sexual performance, drowsiness, insomnia, weight gain or loss, headache, dry mouth, vomiting, and diarrhea. These unwanted symptoms may go away after taking the drug for a few weeks. If side effects do continue, changing medications or dosage can often resolve the problem. The pharmacist warns that stopping this type of medication abruptly can result in very uncomfortable side effects. Whenever stopping an SSRI or SNRI medication, it's necessary to work with the prescriber to taper off the dosage while brain chemicals get used to the change. There are some older medications that are also still prescribed to treat depression. Tricyclics, or TCAs, were first developed in the 1960s to treat depressive disorders. They are still used today when SSRIs and SNRIs fail to work. Tricyclic antidepressants block the reuptake of the neurotransmitter serotonin and norepinephrine, increasing the levels of these two neurotransmitters in the brain. Tricyclic antidepressants also affect other chemical messengers, which can lead to a number of side effects. Common side effects of TCAs are the same as those of SSRIs and SNRIs, plus blurred vision, urinary retention, drop in blood pressure, and increased sweating. The biggest risk of TCAs when prescribed for depression is their potential to be used to attempt suicide. Overdoses of TCAs can be deadly. Like most antidepressants, these drugs can take 2 to 4 weeks to start working and 2 months or more to see full improvement. MAOIs, or monoamine oxidase inhibitors, have a long history of use as a treatment for depression. Once a message has passed through the synapse, some neurotransmitters are metabolized. Monoamine oxidase is the chemical that dissolves the neurotransmitters. MAOIs, or monoamine oxidase inhibitors, stop the breakdown of neurotransmitters in the synapse. This makes more neurotransmitters available in the synapse, which increases the transmission of messages. These medications have few side effects, but they have another serious problem all their own. If people taking these drugs eat foods containing certain amines, they may have a severe spike in blood pressure. These dietary restrictions include several foods people don't like to give up, like chocolate. I guess we could all survive without sauerkraut and pickled fish, but chocolate? One method of delivering MAOI medication is through a transdermal patch. Applying a daily patch doesn't appear to cause the spike in blood pressure and doesn't require any dietary restrictions when used at the recommended dosage. Overdoses using MAOIs are also deadly. Due to these dangers, prescribers only recommend MAOIs when other antidepressants have failed. Starting a new antidepressant medication may trigger a manic episode in someone who has undiagnosed bipolar disorder. It's important to let your provider know how your body reacts whenever you start a new medication or when medication dosages are adjusted. In these cases, guidelines generally recommend starting a mood-stabilizing medication before prescribing an antidepressant. Some depression is treatment-resistant, meaning it doesn't respond to first-line antidepressant medication. Psychiatrists may choose to prescribe another antidepressant in addition to an SSRI or an SNRI. Some newer antidepressants work to increase other neurotransmitters. A combination of these antidepressant medications often effectively treats depression. So you can see there are a lot of medication options available to treat depression and depressive disorders. If the first medication doesn't succeed, keep supporting your son to work with his provider to find something effective and don't give up. Many people find that a combination of medication and talk therapy is most effective. Now, let's talk about medications that can be used to treat psychosis. Antipsychotic medication reduces or eliminates delusions and hallucinations. Antipsychotics play an important role in treating schizophrenia, schizoaffective disorder, or any of the other disorders that are causing symptoms of psychosis. Delusions and hallucinations result when there is too much dopamine in the synapses. Antipsychotic drugs prevent dopamine from binding to the receiving dendrite. They do this by occupying the dopamine receptor sites so that transmission is blocked. The term used to refer to the older antipsychotic medications is first generation. They are high potency, meaning they block more dopamine receptors, are less sedating, and are available as long-acting injectable or LAI forms that can be given every 2 to 4 weeks. Long-acting injectables are especially helpful for people who have difficulty remembering to take their medication, are unable to absorb the pill forms, or simply prefer this option. One of the challenges with the powerful dopamine blockade of high-potency antipsychotics is that they can affect neurons outside the brain that move muscles. This can cause movement disorders such as tardive dyskinesia, which is an uncomfortable, often embarrassing condition in which the brain misfires and causes random, uncontrollable muscle movements or tics in the arms, fingers, legs, toes, or facial muscles. Roberto reflects on how difficult it would be if his son got relief from one serious problem, only to be faced with another. The pharmacist assures him that there are other alternatives, and new research is indicating that more effective drugs with less side effects will be available in the future. Newer second-generation atypical antipsychotic medications selectively block neurotransmitter receptors in the brain to produce specific benefits. These second-generation medications aren't necessarily better or worse than first-generation, but they do have different side effects. Second-generation antipsychotics, unfortunately, are more likely to result in weight gain. Individuals on these medications put on weight due to sedation, appetite stimulation, and an inability to feel full. For those who stay on these medications, obesity can cause serious cardiovascular risks like elevated cholesterol levels and high blood pressure. Obesity also increases the likelihood of developing type 2 diabetes. The Food and Drug Administration, or FDA, requires all atypical antipsychotic drug labeling to include a warning about prescribing the drugs for people at risk for hyperglycemia or high blood sugar and diabetes. Roberto asks about other medications that are commonly prescribed for bipolar disorder. Mood stabilizers are the most common medications for treating the mood swings associated with bipolar disorder. The oldest of them, lithium, has been in use for over 50 years and has proven to be very effective, particularly for bipolar I disorder. However, regular blood tests are a requirement for anyone taking lithium, which has potential serious side effects to the kidneys and thyroid. There are also medications now approved for use as mood stabilizers that were originally created to treat seizure disorders. These are known as anticonvulsants and often work better than lithium for some people. Mood stabilizers can prevent highs, both manic and hypomanic episodes, and also prevent lows or depressive episodes. There is one more category to tell you about, and that is anti-anxiety medication. These work to reduce the emotional and physical symptoms of anxiety. Benzodiazepines can treat panic disorder, social phobia, and generalized anxiety disorder. Heart medications known as beta blockers are also effective at treating the physical trembling, sweating, and other physical symptoms experienced by people with phobias or panic disorder. Anti-anxiety medication works quickly and is very effective in the short term. However, people prone to substance abuse may become dependent on benzodiazepines. Roberto is amazed at all the options that the pharmacist has readily available, but he wonders if there are any new drugs in development. The Food and Drug Administration, or FDA, regulates all prescription medications available in the U.S. The process of getting FDA approval for a new medication or for an old medication to be used for a new purpose is very long. It can take years. However, physicians often find that although a medication hasn't been approved by the FDA for use with a particular condition or for a particular group of people, it has been shown to be effective in clinical practice. This means that the FDA doesn't have conclusive research to show that it works, but the physician has experience that indicates it does. Rather than wait for FDA approval, the physician has the authority to prescribe that medication anyway. This is called off-label prescribing. This happens often in the medical field because in order to help their patients when they need it, caring practitioners often can't wait for FDA approval for every possible condition. You should also be aware that generic medications and brand name medications are not exactly the same. The FDA requires that generic medications contain the exact same active chemicals as those in brand or trade name medications, and that the route of administration, whether it's available as tablets, capsules, patches, or injections, be identical. Other characteristics are allowed to be different, specifically inactive ingredients, such as color, flavor, fillers, and binders. These inactive ingredients usually vary between drug companies and can influence the way a medication works for different people. If you notice changes in someone's symptoms and the look of the generic medications they're taking has changed, tell the prescriber. The symptom changes may be caused by the change in the generic medication and can be easily corrected. Not all medications approved by the FDA to treat mental health conditions in adults are also approved by the FDA for use in the treatment of those same conditions in children and adolescents. To learn whether or not a medication has been approved for treatment in people younger than 18, ask the professional who is prescribing it, talk with a pharmacist, or research the manufacturer information online. Some psychotropic medications for children and adolescents come with what's known as a black box warning. This warning appears on prescription drugs that may cause severe adverse effects. The term black box refers to the heavy black border used to draw attention to these warnings. These warnings are required on any type of medication that the FDA thinks needs it, not just the ones used to treat mental health conditions. Here are just a few of the medications that have had black box warnings added in recent years, and the reasons why. Depo-Provera, a contraceptive injection because there is a risk of significant loss of bone density with long-term use. Warfarin, an anticoagulant or medication that prevents blood from clotting because there is risk of bleeding to death. Xolair, an asthma medication which may cause life-threatening allergic reactions. Elidel cream, used to treat eczema because it may increase the risk of cancer. In 2004, the FDA began requiring that pharmaceutical companies add black box warnings on all antidepressant medications, stating that the risk of suicidal tendencies may increase in children, adolescents, and young adults aged 18 to 24 using these medications. This requirement was based on reports of increased rates of suicide attempts and death by suicide in children and adolescents who were taking an antidepressant. The black box warning does not mean that the antidepressant medications caused the suicidal behaviors. It just means there was believed to be a connection, and physicians prescribing those medications should closely monitor children taking them. The FDA wasn't recommending against the use of antidepressant medications by children and adolescents. Instead, the FDA was trying to improve medical care by encouraging providers, parents, and children themselves to monitor and collaborate on their treatment more fully. The future of treatment for mental health symptoms is actually very hopeful. Scientists are learning more every day. These chemical events eventually change the way the sending and receiving neurons function. It's then that moods and behaviors change, and it's apparent that the medication is working. Research is now concentrating on understanding those changes that happen within the cell, believing a more effective target for drug action may be revealed. You may want to do some research yourself and read about other new discoveries that may change the future of psychotropic medication options. NAMI's website is a great place to start. Roberto feels encouraged. He now has a much better understanding of how psychotropic medication works, why prescribing the right medicine is so difficult, and how many options are available.